Okay, good afternoon, everyone. We might get started. I'm Professor Leung. I'm the convener of this APSAD webinar symposium that we're putting on over the next couple of weeks. And I'm also the convener of the APSAD National Conference that was in Brisbane this year, but is now going to be Brisbane next year. So please come along and join us there. Liz, can you put the welcome up? Thank you. First of all, APSAD would like to acknowledge the traditional owners of the land throughout Australia and their connections to land, sea and the community. We pay our respect to their elders, past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people today. It's now my pleasure to introduce the host of the show, which is Professor Michael Farrell, who's the president of APSAD and also the director of the National Drug and Alcohol Research Centre. So I'm handing over to you, Michael. Thank you. Enjoy the show.
Thanks very much, Leanne, and thank you for all of your hard work in putting this together. And I'd also like to note that we're meeting across many traditional lands, and we pay our respects across all of those lands. And just to say that today we have a smorgasbord and feast of young researchers talking about the impact of COVID. And what is fascinating about this is all of the presentations will show the example of people pivoting very rapidly in the last few months to pick up projects and address issues in a way that is truly impressive. So what I'd like to start and introduce our first speaker, which is Sarah Callinan, who'll be talking on purchasing, consumption, demographic and socioeconomic variables associated with shifts in alcohol consumption during COVID-19. So over to you, Sarah.
Thank you. I'll just share my screen. Sorry. Can everyone see that? Yeah, wonderful. Okay, so I'm going to be talking about shifts in alcohol consumption during the COVID-19 pandemic. I think I narrowed the scope a little when I got faced with the realities of the 10-minute time. So as some of you may know, COVID-19 was a pretty big deal. Specific to alcohol in Australia, on the 23rd of March, a lot of licensed premises closed and a lot of other options closed. And from the 29th of March until May 16 for the first lockdown, Australians were only allowed to leave their homes for the 4 reasons. So home became the only place that people could consume alcohol. Bottle shops and alcohol delivery services operated as usual. And in fact, if anything, a lot of licensed premises picked up, started delivering alcohol in order to stay afloat during the lockdown. Now, there's evidence to suggest that we could expect some increases in consumption during this particular period, often due to the fact that studies on particularly stressful times in countries rather than say maybe the whole world often show an increase in consumption. However, with licensed premises closed and people no longer allowed to visit other homes, popular drinking locations weren't available during lockdown, which could possibly lead to a decrease. Prior to the pandemic, nearly 2/3 of all alcohol in Australia was consumed in the drinker's own home, but with older drinkers drinking considerably more at home than younger drinkers. What I'm going to be covering here today are results from 2 studies that we put out during the first lockdown, asking people about their alcohol consumption before and during the pandemic. In this first study, it's a convenience sample recruited through advertisements on social media. We were looking for Australian residents aged 18 and over who consumed alcohol at least monthly. Took place from the 19th of April to the 29th of May. And we got about 2,400 respondents in the end, with a mean age of 46.4 and just over half identified as female. And we asked people about their alcohol consumption in 2019 and where they drank their alcohol in 2019. And then ask the same questions again about the month prior to completing the survey. So looking at the mean drinks per day for this particular sample, we didn't really find much of a shift. The overall, the average amount of drinks people were consuming per day really didn't shift much from 2019 to 2020. And we also didn't find massive differences, at least when we were just sort of looking at confidence intervals between sex or age, although there were some indications that the decrease came more from men and came more from younger drinkers than it did from older drinkers and women. So then we decided to have a look and see if maybe there was some shifts in, like, some people had started drinking heavily and some people had moved, or, you know, that kind of thing. And we didn't find a lot of evidence for that either. 81% of people who were low risk drinkers in 2019 were also low risk drinkers in the month prior to having the survey, in the first month of the lockdown. One thing we did find though was that of people who did move categories, there were some more people shifting down than there were shifting up. But overall, there weren't really huge shifts. You know, over half of people who were risky in the risky drinking category stayed that way, and about 2/3 of people in the high risk category stayed that way. This graph's a little busy, so bear with me, but what we're looking at here is how much people consumed in different locations in 2019 and during the first lockdown, stratified by age and sex. And if we look at the 18 to 29-year-old men in the first two columns, what you can see is that in 2019, young men were drinking less than half of their alcohol in their own home. Once those options decreased, they increased their home consumption, but it didn't increase enough to make up for the decreases in consumption in all the other locations. And in fact, it was only young men that this story really held true. If we look at all the other columns, what happened is people increased their home consumption to make up for the loss of options to drink elsewhere. In terms of the proportion of alcohol consumed in the home in 2019 and the risk category, so this is the same thing again, but stratified by what risky drinking category they were in 2019 and how much they were drinking in their own home in 2019. So that first group there drank less than 50% of their alcohol in the home in 2019. And one of the first things you see is that in the high risk group, it does appear that they were the ones who decreased their consumption the most during the lockdown. You can see the three sets of higher columns there. But what's important to note there is there's a very real chance that this is just regression to the mean. So, so it's very possible that, you know, that this isn't so much a real finding as much as a statistical artifact. But interestingly, that decrease does seem to be much larger in the group of people who were high risk drinkers who drank less of their alcohol in the home. So once they lost those options to drink in the pub or drink where they normally consumed their alcohol, they did actually seem to decrease their drinking a little. And apart from that, the story is pretty much the same as it was when it was stratified by age and sex. When the option to drink elsewhere was taken away, people increased their home drinking to compensate. Looking quickly at study 2, which was a much more opportunistic one, we actually had something ready to go out in the field for non-COVID related reasons. And so we were able to quickly change the survey a little. And so we administered an audit and changed it twice, one for, you know, in the past month and one for 2019. And we had some questions on drinking motives and stress in there. Again, this was a convenience sample. It was recruited through social media. We had about 1,684 participants in the end, and in this one we had a higher proportion of people identifying as female. And what we found here is something that I think we've noticed that other people running similar studies have also found, is that while people drank more often, so the score for the question on frequency did increase significantly, everything else decreased significantly except for one of the dependence items, I think. So what that meant was people were drinking more often, but they were drinking less when they did. And because they were drinking less per occasion, they were drinking riskily less, and they were therefore experiencing less harm. And that was something that was quite consistent throughout all the age and sex groups. We only have an 8-item audit here because 2 of the audit items have a 12-month reference period that wasn't particularly suitable to this study. And we had a range of results for this study, but I've just picked out one in particular because of time. But what we did find is that people who experienced higher levels of stress did increase their score on the dependent subscale of the audit. That's the subscale that tends to have lower scores, you know, and obviously more indicative, say, of perhaps needing treatment down the track. And that was the only group that seemed to genuinely increase in their dependent scores, were those who were experiencing high levels of stress. There were some indications that that this was possibly a response to drinking to cope with a difficult situation. It looked like it was happening more, with people, for instance, who were dealing with those dual childcare and work roles in the home. I've spoken too quickly as usual. Overall, in our convenience sample, consumption in homes appears to have risen to compensate for not being able to drink elsewhere. However, we also found that people were spreading their consumption out. They were drinking more often, but they were drinking less when they did, which was co-occurring with a decrease in harmful drinking as per the audit. Things to look out for, people, particularly those with young children who were dealing with those dual roles, drinking to cope with difficult pandemic-related circumstances. And also long-term, what we're really interested in seeing is if there's going to be a possible increase in consumption overall, as drinking in the home is quite habitual. It's a very sort of habitual practice. And what we're worried about is people have gotten used to drinking more in the home, and then all the other options of places to drink. So you're allowed to go out to your friend's place or the pub or wherever, but you've also gotten used to drinking more every day during the week at home. And one of the things that we took from this that I think we're most interested in, sort of outside of a COVID-19 sort of area, is the fact that it was the heaviest drinkers who drank the most in licensed premises and other people's homes before the pandemic who seemed to decrease their drinking quite a bit during the pandemic. Because there's always this idea that if a policy shift or just circumstance reduces the options for people to drink, it'll be the heaviest drinkers who will always find a way, or and so on and so forth. And we had some evidence here that something happened, and this was the group that actually decreased their consumption the most because drinking became less convenient for them. Limitations, it's a convenience sample, it is what it is. We recruited via social media. In the first sample that I showed you, because I showed them in reverse order, we learnt our lesson, and so we spent a couple of weeks only advertising to men so we could have a more even sample in that respect. Age didn't end up being the problem we thought it would. In the past, we've had quite old samples with Facebook, but it wasn't too bad. But, and it was a great way to get a study out quickly during COVID, but it's obviously not representative. And we're super keen to see how our results line up with, work of people using other methodologies. We also asked people to estimate their consumption in 2019 and in the past 30 days, and there's going to be error associated with that. We're hopeful that it's a bit more accurate than asking people to guess whether they increased or decreased their consumption, because we're not sure how people would calculate the quantity versus frequency issue, especially seeing they seem to move in a different direction, but it's also got genuine, recall issues as well. We're really hoping to keep following up on these people to track, how people came out of lockdown outside of Victoria and how we continued on with it, and also how people continue to drink when those options to drink elsewhere are brought back. And so we've got, if anyone's interested in seeing more of the results from these two studies, we've got one published in Drug and Alcohol Review and one in Addiction. And this was a massive effort by a large group of people to do a lot of work very quickly, but especially my colleague Yvette Mejica-Perez, who did a mountain of work, with the online surveys and administering them and everything. And that's it. Thank you very much.
Thank you very much, Sarah. Your timing on that was perfect.
Ah, there we go.
And you've presented a lot of information in a very short period of time, very clearly. So thank you. And to let people know, what we will be doing is we will be having some discussion at the end. And if you have questions, you can put them up on the Q&A function and we will handle them through that. So thank you again, Sarah. So now to Queensland and looking at adolescents living through COVID-19, drinking, substance use and well-being, from Dr. Janni Leung. Janni.
Thank you, Michael. I didn't know that Michael was timing, so mine might be a bit short, but oh well.
Don't worry, we'll make sure you're fine.
Okay. Thanks. So yeah, I'm Dr. Janni Leung. So a little bit of background. My background is survey data linkage, systematic review, and meta-analysis. And now I'm ECR in addiction and mental health at University of Queensland in Brisbane, School of Psychology, Licensed Well, and CISA, which our new center name is NISA. and I'm affiliated with UNSW and DAC in Sydney. So following on from Sarah's study looking at adults, then now I'm presenting on another study, which is the Adolescent Aware study looking at adolescents and grade 12 specifically. So a little bit of a background on the Adolescent Aware project. It's a project led by Dr. Kat Quinn, who's on maternity leave at the moment. So it's a project collaboration between QUT and UQ in Brisbane. It measures in adolescents alcohol and drug, LD use, peer factor, well-being, and it's across different schools in Southeast Queensland, has been collecting data since 2015. So now I'm focusing on in this year that we have an extra survey to we asked the user survey, but also extra items in regards to how COVID has impacted the students. So data collection started from June 2020 of Year 12 students. We got 10 schools invited and 9 said yes. So we got more than 800 people in the sample. Thanks to Sarah, you got reminded of the COVID timeline. So just highlighting the data collection started when the schools reopened from June to October. So pretty fresh data as well. So some preliminary findings for the emotional health items. We asked during the restriction phase when the social distancing were most in place, how were they, did they feel like more, no change or less in these items? So we can see there's a little bit of a spread, like a little bit of more people, like for example, like some people said they were more anxious. Yeah, about more than half said they were more anxious about the exams. And then some people reported no change, and then a little bit of people said less. For the alcohol and cannabis consumption, we asked them now, so that was from June to October, whenever the survey was compared to pre-COVID. Was the drinking and cannabis in frequency, quantity, and we can see some reported more, some reported no change, and then some reported less. So we did a quick correlation so far. So data cleaning, and this is just a quick correlation. And we found some associations between the people who answered yes for feeling more anxious or more depressive symptoms. There were some correlations with people saying yes more for alcohol and cannabis. So we also have data for the Year 12 people from the last year's cohort, and then just having a look at their emotions and substance use as well compared to this year's cohort. And we found that compared to last year, this year's have increased anxiety measures and also increase in alcohol drinking 2 times or more a week, and so more drinking, and more of them has used cannabis in their life as well, and used for more than a week. More of them said yes, they've done that. So some limitations when for the data collected, we asked them now, that's at the time of the survey. So that's a little bit different to other, different depending on the people who, so we have to adjust for when the data was collected in regards to the COVID timeline. And they also have to remember before, so that could be answering bias, interpretation of more, same and less answers, because people who are in the more category doesn't necessarily mean that they are the high risk. If let's say they were like starting off with not a lot, but drinking a little bit more compared to those like drinking a lot people who said they drink less, then the less people could potentially still be more high risk. So we need to take into consideration the actual levels in the final analysis. The representative of the sample is a limitation as well because it's independent schools. And lastly, the key limitation is comparing the last year's cohort to this year's cohort. This year was a little bit older, and we saw, I think the whole population, other research also showed that anxiety level for the whole population increased, but especially for year 12, then they have a change of education system in Queensland, so that could be affecting their mental health and emotions as well. So in summary, overall for the whole group, then many people of the adolescent reported less or same levels of drinking, and that could be associated with what Sarah was saying before, like less going out and then maybe less partying, that could be. But we also found that there was a substantial minority proportion that reported increase in substance use, and we found that that group was associated with worse emotions or feeling anxious or feeling depressed, so they would be the more at-risk group. So in conclusion, it's important to support the students' emotional well-being and prevent harmful substance use because that affects their development into the future. I would like to acknowledge the whole team and the young people who took the time to answer the surveys. Thanks very much.
Thank you very much, Janni. And again, your timing was excellent. And thank you for giving a very complex presentation in a very clear and succinct manner. So with that, I'll carry on to our next speaker, which is Amy Peacock from NDARC, who's speaking from Hobart, but we'll be talking about COVID-19 impacts on illicit drug use, markets and harms in Australia, findings from the Sentinel surveillance. Over to you, Amy.
Thanks, Michael. I don't think you'll be giving me that same compliment about time at the end, unfortunately. So I just want to, as well, acknowledge the traditional owners on the land on which we meet today, and pay my respects to elders past, present and emerging. And I'd also like to acknowledge the very many people listed on this slide who've contributed to the work I'm going to present today. So that includes our funders, the members of the research teams, both past and present, stakeholders who've helped out, and most importantly, our participants across these projects. So I'm not going to spend too much time on the background because I really want to spend most of the time talking about results, but I'm going to focus more so on illicit drugs at this stage. And just in terms of when the COVID-19 pandemic kicked off, there was quite a lot of concern as to the array of impacts that we might see with illicit drugs. So there was concern around impacts on illicit drug supply, that we might see shifts in drug use and in drug-related behaviours, that there might be potentially increases in harms for some people, and also that there might be disruption to help seeking and service provision. So I'm going to structure the talk today to work through the data that we've got available from Sentinel studies of people who regularly use illicit drugs to test out and see how those all these hypotheses hold up. So in terms of the data sources I'm going to be using, it's from 3 projects. The first one is the Ecstasy and Related Drugs Reporting System, which is annual interviews that have happened since 2003 with cross-sectional samples of around 800 people who regularly use ecstasy and other illicit stimulants in Australia. The Illicit Drug Reporting System, it's a similar model, except it's with around 900 people who regularly inject drugs from across Australian capital cities, recruited via NSPs and word of mouth. And then the final study is a new study that came about with COVID-19, the Australians Drug Use Adapting to Pandemic's Threats, or ADAPT study, which is slightly easier to say, which is an online longitudinal cohort of Australians who regularly use illicit drugs in 2019. And I'm just going to be focusing on the 308 people who've completed 2 waves of follow-up today. As the others have mentioned, it's really important to consider when this data collection has occurred relative to the COVID-19 pandemic and restrictions in Australia. So to give you a bit of an idea, with IDRS, so the sample who regularly use ecstasy, we began interviewing them in late April, and it ran through until around July. With the sample who regularly inject drugs, so IDRS, that occurred later. So in this case, when most jurisdictions, Victoria had restrictions lifted, so from July to around September. And then with ADAPT, as I mentioned, there are 2 waves of data collection, so from April to June, and then from around July to September. So the data that I present, it's from convenience samples, so it's not going to represent all people who use illicit drugs in Australia, but I think one benefit of drawing these studies together is that they do potentially tap into different populations. In saying that, and as the others have said, it is important to consider these data alongside other sources. And I feel like I'm showing you about 1% of the data that's been collected here. I'm going for a high level summary in 10 minutes. So I'd really encourage you to email or get in contact or check out the bulletins if you want more information. So as I said, high level, let's go quickly. So drug market. So what we do, particularly for IDRS and ADRS, is each year we ask people about the perceived purity, the perceived availability, and the last price paid for a range of illicit drugs. And we're getting quite a mixed picture across the different drugs in terms of the types of impacts we're seeing. So focusing first on the data from ADRS, when we look at ecstasy and cocaine and look at what we're seeing over time, and take into account the trend that we were seeing before and how it diverges for 2020 with COVID-19, we find that there are reports of, particularly for MDMA, disruption to perceived purity and perceived availability in terms of both of these declining. What I think is most interesting is around heroin and crystal methamphetamine though. So this is predominantly from data drawn from the sample who regularly inject drugs. So as I mentioned, collected a little bit later on, so July to September. And we're seeing that across the board, people are reporting declines in the perceived purity and availability of these drugs and increases in price. And this is aligning with reports from other studies that are talking with people about their experience of these markets. But as I said, it is a mixed picture. With respect to cannabis, we're not seeing reports of huge shifts in the market, and similarly for LSD. Moving to look at drug use. So because of the constraints around how much we have to fit into the interview, in this case, it is asking people about their perceived change in drug use since March, so since restrictions as compared to before. The grey bars, no change. So you can see that for most of these drugs, of those who reported use in the last 6 months, they're saying that their use was pretty stable since March as compared to before. Although I do want to direct your attention to the middle when you look at ecstasy. So this is our sample who are regularly using ecstasy. And it's just interesting to note that around 2 in 3 reported that their use of MDMA had stopped or declined since March as compared to before. Moving to look at our sample who regularly inject drugs, it's a similar picture in terms of those grey bars really standing out, representing no change in use. But again, just want to direct your attention to the bottom of the figure with heroin and methamphetamine, with 32% for heroin and 45% reporting reduced use of those drugs since March as compared to before. So just going back to that comment around the drug markets, I think that this is a really interesting finding. And particularly when we talk to people about the reasons why they thought their use had increased or decreased since March as compared to before. So overwhelmingly, it really did come down to the social factor. So fewer opportunities to go out and be with people to use drugs in terms of decreased use. But when we asked people about their reasons for decreased heroin and methamphetamine use, those market features came through again strong. So increased price and more difficulties in accessing those drugs. Talking to people about reasons for increased use, we heard that boredom, more time to use drugs were common factors, particularly for drugs like alcohol and cannabis. The other one that really stood out as interesting to me for alcohol was that people were saying that they had increased their use of alcohol because of increased price or increased difficulties accessing other drugs. So there is some evidence there for some people of a substitution towards alcohol. With respects to health, so in these samples that we're looking at, so for ADRS and IDRS, we didn't see a clear evidence of an increase in non-fatal overdose when we asked people about their experience pre and post-March and when we compared to previous years. But again, I'd just like to reinforce, I think this is where it's important to look to other data sources, so ambulance, emergency department, to explore what's happening there. In the sample who regularly inject drugs, we did see small numbers reporting an increase in behaviours that could be considered risky relating to their injecting drug use, although those numbers were relatively small. But I just want to emphasise as well the broader backdrop against which we might expect changes in drug use and harms to occur. So focusing on mental health, for the samples that we looked at, it's around 1/3 who said that they thought their mental health was worse now as compared to COVID-19. And I guess another thing that stands out to me is with the longitudinal data that we've collected, so looking at the ADAPT sample, it's relatively consistent in terms of the percentage who reported that their mental health was worse at 2 time points, which, I mean, it's a perception, it's a single scale, it's not a validated measure of psychological distress, but does suggest that those impacts are potentially more pervasive, particularly given that most of our participants weren't experiencing restrictions at the point of wave 2. Finally, drug treatment. So this is focusing on our sample who regularly inject drugs. Around half reported experiencing disruption to their treatment since March, but it was predominantly around shifts to adjust for the fact that treatment couldn't be delivered face-to-face. Of those in opioid agonist therapy, most reported no change in treatment in terms of dose, script length, picking up from pharmacies, etc. Although one quarter did say that they were getting more takeaway doses since March. And most people said that their treatment satisfaction was unchanged since March as compared to before. Looking at difficulties in accessing treatment, of those not in treatment, around 1 in 10 said that they had tried but had difficulties accessing treatment since March. Around 1 in 10 of our total sample said they'd had difficulties accessing sterile injecting equipment since March. And on a positive note, quite small percentages said they had difficulties accessing naloxone or HCV testing and treatment. So to conclude, it does look like for some drugs we are seeing a shift in the market based on data from these samples. And in terms of what's going to happen next, it's a bit difficult to tell at this stage. I think it's really going to depend on the extent and duration of restrictions, not just in Australia, but in the countries in which that supply Australia as well with these substances. But it does warrant very close monitoring, I think, in terms of what's going to happen with substance use, treatment seeking and harms if we do see ongoing disruption to these markets. As mentioned, most people, and I think this aligns with what Janni said, reported stable or declined use of illicit drugs since restrictions, although there's huge amounts of heterogeneity there across the substances and also between individuals. And I didn't really get time to disentangle that, but there was no one pattern that we saw across the samples. When I've talked to people about this, they go, "Oh, isn't that great? People are, stopping using drugs." And maybe that is true for some people, but I think it is a little bit simplistic, particularly knowing that most of the reasons that people decline were due to social factors around the restrictions and market factors. So they are transient things, and if they change, it might see people start to use more and their tolerance might not be there. We may see increased overdose risks. So I think that's important. Really quickly, final conclusion. So harms and health. For these samples, as I said, we're not seeing evidence of increased harms for those harms that we measured, but I think the routinely collected administrative data is going to be absolutely critical to measure this ongoing. And I just want to re-emphasize, I know I just only mentioned mental health, but focusing on drug use only is somewhat simplistic for some of these people. We know that they're facing many challenges and that COVID-19 has potentially exacerbated financial hardship, physical health, mental health, and so on. So it can be quite a complex picture for some people, and that might be worse at this time. And finally, with help seeking, we did hear reports of disruption to service provision, but most people said their treatment satisfaction was stable, that they weren't seeing major negative consequences because of that. And that's really testament to how, I guess, everyone mobilised, those working in the sector, to make sure that people had that service continuity, which is just so important to note and to acknowledge and praise, I think. There was some evidence for greater treatment flexibility. We did see some people reporting more takeaway doses, and hopefully that's something we can see longer term implications in terms of greater flexibility going forward into the future as well. So if you'd like more information, please check out our reports and do get in contact. Thank you.
Thank you very much, Amy. And again, very clear and succinct and on time. So very much appreciate that. And now we're actually going over from hearing those things, and we will have the opportunity to come back and answer some questions on this, because it is a complex picture, and I think we could spend the whole afternoon talking about it if we had the time. But this next presentation is the consequences of the COVID-19 pandemic on AOD outcomes for staff and clients. So it's got a bit of a staff focus on it too. And this is from Dr. Molly Carlyle, again from Queensland. Thanks. Over to you, Molly.
Thank you. I'm just going to share my screen. Can everybody see that okay?
Yep, good, working.
Fantastic. So I'm a postdoctoral research fellow with the Lives of Dwell Research Group at UQ, and I'm going to be reporting on some data that we collected that has been looking at the impact of the COVID-19 pandemic on outcomes for people who use alcohol and other drugs that have been seeking treatment during the pandemic, and also from staff who have been providing treatment during the pandemic as well. Before I start, I would first like to acknowledge the traditional custodians of the land which we meet. So for me, that's the Jagera Turrbal people, and acknowledge their elders past, present and emerging. Ooh, let's change it. Okay. So this has been discussed in the previous talks today, but there is evidence of changes in trajectories of drug use due to the pandemic. And there are two main trajectories. So there's been reports of decreased substance use, which corresponds with a reduction in the social environments which substances are typically consumed. So for example, Amy was saying about reductions in MDMA use, which may be linked to the closure of festivals and bars and clubs, and also limitations in market factors as well. However, there have been corresponding increases in substance use, which may be related to greater stress, uncertainty, and certain pressures around the COVID pandemic. So, for example, financial pressures or employment, which could exacerbate substance use problems where substances might be used to cope during this period. And it is more likely that more dependent populations are going to be disproportionately impacted by these stresses and these uncertainties. And that's really concerning because these groups of people are more at high risk of suffering the negative consequences of the pandemic. So there are limitations in the extent to which some of these people might be able to socially distance or quarantine. For example, people on opioid substitution medications who would be usually going into pharmacies to receive their treatment. But there's also existing physical health problems that might occur prior to substance use, but also as a consequence of it, and increasing the risk of a negative response to the virus. And also comorbid mental health problems and high rates of loneliness as a consequence of social distancing. So, I think this is moving forward. Okay. So it's really important that we try and understand what kind of contributors will lead to changes in AOD use. Firstly, so that AOD services are able to adapt, so that they can adapt their services so that they have the best quality of care through the pandemic periods, but also to mitigate the individual harms of the pandemic on these groups of people. So as I was mentioning about being at high risk, if we can mitigate some of those harms, it will lead to a higher quality of life during these periods, and also leads to a reduced impact on healthcare as a consequence. It's also important to understand how the AOD services have already responded during the pandemic as well, and whether this is in line with prior suggestions of the best strategies to use. So within the studies, we recruited 2 groups of people. So we recruited AOD clients who had sought treatment for their substance use from January 2020 onwards. And we recruited them through an SMS survey that was sent between July and August of this year. We also recruited AOD staff, and these were people who had direct contact with clients. So these were counsellors or people or supervisors of counsellors, and they were contacted through email to take part in the survey as part of an organisational survey, which was collected between August and September this year. So our main aims were looking at how the impact of the pandemic on frequency and quantity of substance use, and how mental health factors might contribute to changes in this. We were also interested in looking at changes in AOD-related risk behaviours in clients as well. And then we were interested in whether the pandemic had impacted treatment preferences in clients and service provision by AOD staff. So I'll go through this fairly quickly as I know we're limited in time. But the two surveys were cross-sectional. And in the clients, we measured substance use patterns using 2 different questionnaires. We also measured mental health. So we specifically looked at depression, anxiety, trauma, and resilience. We asked about their service preferences through the pandemic and also socio-demographic characteristics. And in staff, we measured service delivery and how that was impacted by the pandemic, and also work-related wellbeing. So what we found, with reported quantities of substance use by clients, we asked them to report on the substances that they'd used in the past month, how much they would use in a typical day now. And we asked them to also retrospectively report on how much they would use before the pandemic. So with this, there was a significant increase in the number of cigarettes used per day, which increased by around just under 1.5 cigarettes per day. And there was also a significant effect for cannabis. So the data for this for cannabis was non-parametric. So we did a non-parametric test, and as you can see, the median doesn't change from before to now, but the interquartile range is larger now. So it seems to suggest that there's more variation now compared to before the pandemic. We also asked clients to report on their frequency of substance use now compared to before the pandemic. And we asked this for alcohol, cannabis, methamphetamine, and other illicit drugs. So there was fairly equal distributions of people who reported using less frequently and also using more frequently, and no change for alcohol. For cannabis, there were slightly more people who reported using more frequently as a consequence of the pandemic, whilst for methamphetamine, there was more reports of using less frequently, which seems to align with the market factors and limited availability during the pandemic. And then for other illicit drugs, there were slightly more people who reported using more frequently, but this isn't much higher than people who reported using less frequently. So we were interested in looking at how mental health may be associated with people reporting using less or more frequently compared to before the pandemic. And we analysed this using a series of multinomial logistic regressions. And we had no change as the reference category, and we were interested in looking at how depression, anxiety, trauma, and resilience may be associated with an increased odds in using less frequently now or more frequently now. So with these findings, I've just got a graph of the significant results. So for alcohol, depression score was significantly associated with a greater odds of using more frequently when compared to no change as a consequence of the pandemic. For cannabis, there was a significantly greater odds of using less frequently with increased anxiety, as you can see here, compared to no change by the pandemic. And also for resilience, there was a decrease in the odds of using less frequently as resilience increased, which is interesting and was unexpected. However, there's a similar trend for methamphetamines as well, where there was a significantly reduced odds of using less frequently with increased resilience, in addition to a reduced odds of using more frequently with resilience. So this seems to suggest for cannabis and methamphetamines that there's maybe resilience is associated with no change in cannabis use and methamphetamine use more so than using less or more. and there were no other significant effects of mental health on substance use. We then looked at substance use patterns, so AOD associated risk behaviours, and there was similar distributions between people reporting that they didn't engage in any more time in these risk behaviours as a consequence of the pandemic. And then there were around, half of the people were reporting that they engaged in some of these behaviours some of the time or more as a consequence of the pandemic. So similarly, we followed these up with logistic regressions to look at how mental health may be predictive of the odds of people increasing in the frequency of engaging in these behaviours because of the pandemic. So with this, we found that anxiety was associated with an increased odds of using earlier in the day more often, as well as using to alleviate boredom more often. We also found that depression was associated with an increased odds of using to increase enjoyment and pleasure more often because of the pandemic. And similarly with loneliness, depression was associated with increased odds of using to alleviate loneliness. So that was, interesting. We then looked at client treatment preferences during the pandemic and whether this altered. So we asked them, compared to before the pandemic, how likely they were to seek treatment, like different forms of treatment now. And the willingness to engage in different service types increased for all of them. It significantly increased for every type of service we asked. Which is interesting. So there seemed to be a willingness to engage in all different types of treatment. The effect sizes were largest for telephone treatment, and also virtual video services and web-based programs and messengers. So in terms of staff treatment delivery, we asked staff to report on the proportion of time that they spent delivering different services throughout the pandemic period. So we asked them before the pandemic, during the strictest social distancing requirements, and now. And what we observed was a significant decline in face-to-face options, which have significantly increased since the strictest social distancing requirements. However, these are still significantly lower than they were before the pandemic. This corresponds with an increased use of telephone options. So this significantly increased during the strictest lockdown periods. However, it's declined since then, but again, still significantly higher than it was before the pandemic started. There were less evidence of changes to virtual or video options during the pandemic. And in terms of the number of weekly clients that were allocated to staff as a consequence of the pandemic, this increased from 1 new client each week to 2 new clients. We also asked some questions around staff wellbeing. So we asked whether people spent less or more time feeling anxious about their workload or feeling stressed or burnt out. And as you can see here, the majority of people reported spending more time or the same as before, feeling anxious around work and feeling stressed or burnt out. However, the majority of people didn't report any change in the frequency of using alcohol. So this is just staff. So to summarize, depression, anxiety, and resilience were important factors in the frequency of substance use and also in associated behaviours. And interestingly, AOD clients were more likely to seek all different types of treatment services. In terms of service provision by staff, there was an increase in telehealth options, which was in line with previous suggestions and advice, which is, good news. I think I'm going over time, so I'll go through this fairly quickly. The issue with the current data is that this is cross-sectional. So it's possible that increases in depression and anxiety might be linked to the changes in substance use, but also it might be that changes in substance use could be linked to changes in mental health as well. And also AOD services could ensure support for staff around workload and anxiety during the pandemic period. sorry, I'm going through. Sorry, I just got a message there through. Yeah, so providing support during the pandemic period. So, for example, support around adjusting services in line with the restrictions. So, for example, doing some of the telehealth options as well. So, I'm just going to go. These are my references, and I would just like to acknowledge the UK research team that were involved in setting up and running the study, and also LiveSwiftWell and the staff that facilitated the project, as well as acknowledging everybody who took part in the surveys. Thank you.
Thank you very much, Molly. That was a very comprehensive presentation on an important topic covering both staff and clients. So thank you. So now we go over to New Zealand, where Ben Birks will talk to us about a survey identifying drug use changes during alert level 4 lockdown in New Zealand. And it actually, it behoves me to note for both Australia and New Zealand that both communities, both the communities and policy framework and all that has been remarkably successful in responsibly addressing this. And I think we should all be very proud of that. So over to you, Ben.
Fantastic. Kia ora koutou. My name is Ben Birks. I'm the Deputy Executive Director in charge of programs at the New Zealand Drug Foundation, and I'm also the chair of the Addiction Practitioners Association over here, which looks after the competence and registration for addiction practitioners. What I'm going to be talking about today is very, very early in the piece compared to a lot of the research that our colleagues over here in New Zealand are doing. What we were really looking for in doing this is the broad brushstrokes that could inform what we were doing right in the moment, because similar to what happened over there, we had 2 days notice before alert level 4 lockdown started. We knew that there was lots of stuff that was happening, that the communities were changing really quickly, and that we potentially could have a whole group of people who use drugs but don't yet identify as experiencing harm, as well as people who do identify as experiencing harm that would face additional barriers to accessing support. So we wanted to try a coordinated approach to quickly identify changes or emerging harms so that we could coordinate action. So we knew that we were sacrificing some of the traditional research robustness that would come along with this, so that we could get that broad brushstrokes in the bit, knowing that our colleagues would fill in the gaps and finesse that through the representative data that they were collecting at the same time and are working on analysing now. So in particular, there are some things that I'm going to pull out of this process that were really helpful that I wanted to share. So we had a coordinated network of organisations who worked at pace to help us to do this. And there were 3 factors that helped this to happen that we identified afterwards. So we had existing connections. We had prepared for this by building and nurturing a community of practice after we had our first spate of deaths from synthetic cannabinoids. So these were organisations who were involved in responding to surges in acute drug harm. It was addiction treatment services, it was ambulance services, it was rough sleeping services, primary care, youth one-stop shops. We're trying to get that whole picture of people who would be first to notice changes on the ground. The other thing was that we planned sense testing discussions in advance, knowing that what we were getting would be what was top of mind for those services. So we wanted to provide the context for people to fill in the gaps with what was being noticed. And that helped us to explain the context around the survey findings, prioritize action. And a really important thing that we found was successful in this was that it minimized the possibility of our anecdotes or wonderings what would happen becoming rumors that were spread around and then would be reported as reality, which can sometimes amplify worry and distress unnecessarily. The other thing was that as networks of frontline organisations, we had collectively the resources and staff time to be able to create new distribution methods to reach a broader group of people. We also, as a result of this, got given some resourcing to create, review and share new information into that space so we could transfer what we were finding out into the community really, really quickly. Here is our learning loops. We're calling it learning loops rather than a full-on methodology for this part of things. So we had that first announcement. 3 days later, we did an initial worry survey into that communities of practice to be able to see what people were worried about emerging. We had reviewed and created information for our website that was context specific in the moment as people were entering into that lockdown state. And we had our first social media sharing blitz around withdrawal advice that was looking at what people needed to do in the context of COVID-19 if they were taking a break from substances. 4 days after that, we had already run our first sense testing with the community of practice after the initial worries survey had been completed to be able to make sense of that. And we had pulled that into a communications framework that we could take to a collection of 4 Crown agencies saying this is how we need to communicate to the general population and our other target groups in there who were many of those who were new audiences for our addiction services, because we're used to talking about people who experience extreme harms rather than those groups who are earlier. 5 days later was when the Pulse survey was released. This is the survey that I'll talk about here, and that was active for 16 days. And we already had 2 major national campaigns underway, which ended up reaching over 2/3 of the population, and with one channel of that, an average of 11 times per person. And 3 weeks after that, we had done that analysis, and this provided us with the information to update those campaign frameworks as we were going. And we could create, using this information that was coming through for what people were experiencing, of the moment advice. So it wasn't the generic harm reduction advice that we are used to giving. It was very specific to what people were noticing at that moment in the community. And we could share that through mainstream media articles, news segments, radio content, online content, and use of Facebook and Instagram marketing and retargeting marketing to directly share those techniques in. I won't go into this. This is a whole other bit, but here's an example of some of the stuff that was created as part of those campaigns, where we were using this information, that broad brushstrokes, to be able to get it out into many different channels so that people would get information that would trigger them to think about things in a different way, given that context, recognizing that many of them may have been thinking, this is what I'm doing to cope right now, and wouldn't identify with traditional messages about alcohol and other drug or addiction harm. So what we noticed, we were asking these alcohol and other drug support services what they were noticing among their tangata whai ora. Little bit of Māori context in there, that's people in search of wellbeing. We had a first section that was looking at changes for their alcohol and other drug use and experiences of harm. And we had a second section that was looking at changes to the illicit drug market to be able to help our friends in the National Drug Identification Bureau to be able to complement their survey. We also had a complementary survey that was run at the same time for people who use drugs to respond to. We heard from 64 services across New Zealand. The bit about this slide for us here is that there was a wide range of services who were responding to us. And interesting, we had a really big response from youth-specific services as well, with 13 being youth-specific and 21 out of that supporting young people. We also had 21 who had services specifically for Māori and 6 with services specific for Pacifica. Among them, similar to what we've heard was noticed over there, we had approximately half indicating that their whai ora's alcohol and cannabis use had increased, mostly due to them feeling bored or anxious, and approximately a quarter indicated that whai ora's substance use had decreased, especially among younger people, mostly because they were finding drugs harder to find, access, or because of the requirement to stay in their houses and making it harder to be able to access substances. When we fleshed that out with the sector, we got some additional information there, looking like alcohol and cannabis increases were probably most likely because those were the substances that had less availability and access issues due to online sales of alcohol, and it was time with cannabis harvest season in some regions here. And the decrease among young people, when we showed that back, those services spoke again to young people to find out more of that context, and that was probably due to increased parental supervision and decreased opportunities to socialise. There were some very different experiences. So the lockdown tended to exacerbate harms for some and less than for others. We found that most services reported that whai ora were not accessing or using drugs in a riskier way, but they did notice some, usually those who had experienced serious harm previously, continued to take actions that could have caused harm in the context. And mostly that was leaving their home during the lockdown, using in larger groups, sharing equipment, changing their suppliers and having unknown suppliers, and then engaging in things like stealing to fund their drug use. We also noticed that youth services were more likely to report that their whai ora experienced withdrawal symptoms compared to adult services. We had about a third of services reporting increases in drug-related harms for their whai ora over this time, particularly aggressive behaviour and mental health concerns. But we had quite a few who noted that other whai ora used lockdown to reduce or stop their use, mainly due to having less distractions, situations that could trigger their use, and less access to substances. And there were a few services who reflected that for them, they noticed as a result of this, that whai ora who were earlier in their recovery journey, or for whom alcohol was their primary substance of concern, had more negative experiences during this period compared to others. A couple of other points. We did notice that from the moment that lockdown was announced, there was a huge increase in the people requesting information about how to reduce the impact of substance use on themselves and others, which really reinforced to us that many people who use substances are interested in being well and not harming themselves and others, which is quite different sometimes from what we hear around this group. It also highlighted to us that there was a gap in accessible information about harm reduction and withdrawal for people who use drugs, which is a much bigger group than people who experience serious harm from drugs, where most of that information is targeted. We also heard that in the survey of people who use drugs, who highlighted that they were more likely to make changes based on information they found themselves, or that was suggested to them by friends or family members, rather than information provided by a health service.
That's great, Ben. If you could finish up.
Yes, this one's the last slide. So we had a change in ways that services provided things, shifted online, worked well for some, not for others. This helped us to prioritise the groups that they needed to immediately target after lockdown finished, and that collection of networks. So being able to hear from a service down there about this group that they were looking out for, and that group out there, meant that they could plan together for assertive engagement as soon as possible. Last point, we're trialling a regular repeat of this pulse survey and sense testing process to help us better prevent spikes in drug harm. We've had a first repeat already, and that had doubled the number of responses, so showing that there is a need and interest for this from the sector. Thank you very much.
Thanks very much, Ben. If you could unshare your screen. Okay, great. Look, we're running a little over time, but we've had a lot of stuff presented, and if people could bear with me, I'd like to have this opportunity. People can use the Q&A or the chat, but I'd like Leanne to give her view of what she sees as a message coming through on this. Leanne, any thoughts?
Sure. This is an unexpected question. It seems like it's a very complex situation. You know, we're seeing increases in sort of, I guess, general population samples to a certain degree, but not, you know, in certain drugs like alcohol and cannabis and tobacco, but not other things like ecstasy and just more social drugs and meth and things like that. I'm quite fascinated by the findings around the heavy users and the drug using samples and what's happening there. And I'm not quite picking it up, but there seems to be almost a bit of a reduction there as well.
Yeah. Well, it looks as if there's, in some of the presentations, there's a bit of a nudge effect when people are in certain situations. Amy, do you want to add anything on that?
I would agree with that. So, I mean, obviously the samples that we recruit are recruited on the basis of regularly using illicit drugs, but even with IDRS, from memory, it was something like 1 in 5 reported reducing their injecting drug use since COVID restrictions as compared to February. So I think there is that impact there. As you say, Michael, it is just about how that plays out longer term for people, I think.
So I think that's the other point, like what Ben presents as a snapshot of a particular time. And one of the challenges in all of this work is looking at things over different times and what's actually happening from the point of view of both COVID, what's happening around drug supply, what's happening around service organization. And there's a lot of moving parts to this picture. And when you're trying to put all these moving parts together, you've got to be quite careful. And I think being tentative is, I do think overall the issue about alcohol, what is most striking is, and I thought the point that Sarah made early on about this notion that people might shift from not drinking at home at all to actually developing new habits around home-based drinking, and that that having impacts, longer term impacts, but that will take time to see. But I also thought that the stuff that Molly did around looking at some of the resilience factors and that's clearly very complicated, and trying to figure out what sense to make of it, you know. And it's a bit like some of these earlier work where you see that the most adventurous youngsters are the ones who are more likely to engage in risk behaviors, and you've got all of that sort of complex interactions.
I do think, you know, Amy made a lot of good points about the context of use and just the market influence. And so I guess a lot of the context is going to change as restrictions either increase or decrease or just keep going up and down, as will the market. So it's going to be really an interesting time to see what happens.
Yeah, I presume that every time there's a suggestion that there's going to be some restrictions, people are more likely, as they do with other things, to stockpile.
Yeah.
And it's a direct function of a social message. The social message is to stockpile.
Yeah.
Yeah. Look, I'm aware we were due to finish at 1:30, so it's gone over 1:35. But I think it's been a very rich range of presentations with a huge amount of information, and this information will be up on the web and will be available to people. And I think we'll also do some social media around it. All of you should draw attention to it, because it's very valuable stuff that would be good for people to see. And I'd like to finish up by thanking Leanne and Liz and all of you for these. You've all been very well behaved and sticking. The timetable was very tight, and it wasn't easy, but we've done well. So, Leanne, do you want to have any final word?
No, I just wanted to thank you, all the speakers, for submitting your abstracts and doing such a great job of pulling this together and just achieving the research you have in the time we've had since COVID struck.
And the other thing is to remind you that there is a session on Wednesday, the 25th of November at 12:30. I think that's it, isn't it? Yep.
Yep.
And if you could promote that too, that would be very helpful. So thanks everybody, and have a great day. Have a great week and stay safe.